The recent overhaul of the Veterans Affairs mental health system, driven by policy shifts under the Trump administration and the so-called Department of Government Efficiency, has sparked chaos and deep concern among both veterans and medical professionals. What was once a structured, if overburdened, system is now facing a crisis that threatens to leave some of the most vulnerable former service members without access to the care they desperately need. The shift away from remote therapy and the sudden reduction of staff are already having measurable negative effects, particularly for those who rely on these services for life-saving interventions. At the heart of the problem is the forced return-to-office policy, a move that disregards years of progress in telehealth and puts logistical hurdles between veterans and their care providers. Mental health professionals are now being asked to conduct sensitive therapy sessions in open office environments, where privacy is compromised and patient trust is likely to erode. These arrangements are not just inconvenient, they may be outright unethical. Therapy requires a foundation of trust and confidentiality, and when patients begin to feel that their deeply personal struggles are being overheard or treated as an afterthought, they will likely withdraw. For veterans already dealing with post-traumatic stress, depression, or suicidal thoughts, this could be the final push toward abandoning treatment altogether. The layoffs are another source of alarm. With nearly 2,000 mental health workers already let go and many more positions frozen or outright eliminated, the system is shrinking just as demand remains high. Suicide prevention coordinators, social workers, and therapists are already stretched to their limits, and the loss of experienced personnel will only increase wait times and reduce the quality of care. The numbers paint a grim picture. Veterans already die by suicide at a rate more than twice that of the general population, and cutting support services will likely push that number even higher. The logic behind these cuts seems difficult to justify. The administration claims that the changes will improve efficiency, but efficiency at what cost? If the ultimate goal is to balance budgets or shift resources elsewhere, it is being done at the expense of lives. For veterans themselves, the changes are a cause for frustration and fear. Those who have built relationships with their therapists are now unsure if their care providers will even remain in their positions. Others are being asked to transition from convenient telehealth appointments to in-person visits that may be geographically or financially unfeasible. The sudden upheaval risks creating a situation where veterans simply stop seeking help, not because they don't need it, but because the system has made it too difficult or humiliating to access. There is also an overarching concern about the erosion of trust in the VA system itself. For years, veterans have been told that improvements were being made, that mental health services were a priority, and that they would be treated with the dignity they deserve. Now, those commitments seem hollow. The message that veterans are receiving is that their needs are secondary to bureaucratic reshuffling and political maneuvering. Some who have relied on the VA for years may start looking elsewhere, seeking private care, or simply withdrawing from the system altogether. That, in itself, is a dangerous outcome, one that could have long-term consequences for public health, homelessness, and even crime rates among veterans struggling with untreated mental health issues. The most troubling aspect of this situation is the sense of inevitability. Many of those affected, both patients and providers, see no real recourse, no path to reversing the damage being done. Protests and complaints have been met with dismissive responses from officials who insist that privacy concerns are nonsensical or that staffing cuts won't impact care. This kind of rhetoric does nothing to address the very real anxieties of those on the front lines of veteran mental health care. If anything, it fuels further disillusionment and frustration. The question now is how bad things will get before real action is taken. Will it take a surge in suicide rates for policymakers to reconsider their approach? Will it take an exodus of highly trained specialists before anyone acknowledges that forcing remote therapists into cubicles is a disastrous plan? By the time the full impact of these decisions becomes clear, it may already be too late for many veterans who fall through the cracks. The system was already struggling under the weight of demand, and these latest disruptions are turning a fragile situation into a full-blown crisis. If there is any hope for reversing course, it must come from a recognition that veterans' mental health is not a political bargaining chip or an administrative footnote. These men and women have already sacrificed for their country, and they deserve a healthcare system that prioritizes their well-being over arbitrary policy changes. Without urgent intervention, The damage will continue to spread, and the consequences will be measured in more than just numbers. They will be measured in lives lost, families broken, and futures destroyed.